Prescriptions for weight loss drugs like Ozempic and Mounjaro continue to skyrocket. Doctors say the drugs are extremely effective at treating obesity. However, extreme weight loss can create new concerns, especially in our physical appearance. Dr. Manik S is a triple board certified cosmetic surgeon. He's here to talk about some fixes post-weight loss. Great to see you, Dr. Bedi.
Thanks for having me back here.
So you do the hard work, you get some of the weight off. Many of us have worked through a lot of this, but then people end up with new concerns. So when people come talk to you, what type of concerns post-weight loss are you seeing most frequently?
Yeah, absolutely. So we see a lot of clients who've been on Ozempic or other weight loss medications. I don't personally prescribe it at our surgery center, but the most common thing we see is people who've had volume loss, deflation, really want to restore back their volume after.
And of course the point is to get rid of the volume to begin with, but when you take and burn off that fat, you're left with a lot of sagging skin.
Yeah.
So I know you have different things depending on different parts of the body that you can work through. Where do people typically want to start having things put back together? I know we're looking at an amazing before and after.
So typically the most common thing we'll have women who want to start on the belly area, the breast area. This client here, she was a mom of 2. She actually was on Ozempic. We had her stop about 3 weeks before. That's a safety issue for anesthesia, so we had her stop a couple of weeks before. She got to our target weight, and I'm super excited to share her case because she's super fresh. We just did her case. She's about a month out. We did lipo 360 on her. We did full tummy tuck, abdominoplasty, and of course we want to make sure she's living that healthy lifestyle afterwards too. So
and a lift?
Yeah, this client did not have lift. She had a tummy tuck, but usually clients will have a tummy tuck and a lift at the same time. She liked her breasts. We did fat transfer to her hips. She said leave her breasts for now.
Wow. All right, so what are we looking at here besides an incredible ab situation?
Yeah, so this beautiful client, this was a mom of 1. She came to see us. She had some laxity in her belly area, and she wanted tightening of her skin, but she didn't want a skin removal procedure. So we internally tightened her skin, we externally tightened her skin, and we took some volume, some fat, and we transferred it to her hip area. And she's a couple of months out, and she's going to the gym, and she's looking phenomenal.
Okay, so
that's amazing.
That is absolutely amazing.
I've never heard of what you just said, internal tightening.
What is internal tightening? And then explain fat transfer as part of it, because that has been a part of both of these cases.
Yes, 2 popular topics. So internal tightening, we use a technology to internally heat the skin, and that tighten it, it shrink wraps it down on the muscle. And then on her, we externally tighten her skin, and if you saw her belly button, it kind of raised up a little bit, so it reduces that laxity.
So were those both non-invasive?
The last client, yes. The last client was. The first one was a tummy tuck abdominoplasty.
Can we take a look at that last picture that we just had up? So this was non-invasively. You are able to solve those lax skin problems.
Correct, yeah. So we tightened her skin internally and on the outside. She did have fat transfer to the buttock area, which we removed fat and transferred it. And she's a couple of months out. Of course, she's going to the gym, so she looks phenomenal after.
But that's a really great thing for people to understand is that you don't have to go through a surgery with incisions to still get some great results.
So no downtime at all for that particular surgery?
So at that time, we list these couple of weeks of downtime. If we're going to do fat transfer, if we're just doing tightening, there's very minimal downtime. But that specific client had fat transfer, so it'll be a couple of weeks of downtime.
And then we've got one more to look at here. Tell us what we were able to accomplish here.
Yeah, so we have clients who are super skinny and they say they want to restore volume. So this woman, she had 3 children before, all via C-section. She wanted to restore volume to her buttock and her hip area. So we did lipo 360 on her. So we harvested fat and we transferred it back to her buttock area. So she had a BBL, which is a Brazilian butt lift, and she's a couple of months out in the post-op.
It's crazy.
I love the fact that we are talking about that it's not always about getting skinny and this and that some people naturally are thin or have gotten thin and they feel that they need curves in some places. So you're truly doing body sculpting on all ends of the spectrum.
Yes, absolutely. It's an art form. That's why I enjoy it and I love it. And this other client here too who just popped up here, so this was another mom of 2. She was a mom of 2. She had breastfed before. She lost volume. So we did what we consider mommy makeover on her. We did a breast augmentation and a lift. So we lifted her breasts and we did a full tummy tuck abdominoplasty on her. And really her post-op photos were so unbelievable that I couldn't believe it.
Unbelievable.
Clearly she's tan, so she's going to the beach afterwards. She was enjoying her body. So phenomenal transformation for her. We helped her through her weight loss journey.
Wow. And that's the thing, is the maintenance afterwards. I think, you know, people are taking, so many people are on these medications, but then they're losing their muscle. So you have to kind of wean them into good habits.
And you
that's
always
probably
preach
the hardest part.
And you always preach a good lifestyle.
Yeah.
That's for sure. That's definitely
Health is
part of
key.
it. All right, Dr. Bedi, great to see you.
Yes,
Some
all
great
right.
results and some good motivation for all of us. To learn more about Dr. Bedi and what he is doing, you can go to tampasurgicalarts.com.